Good evening, all of my beloved colleagues today to be here with us. Hope that all of you are good in your health and attention as well in your study. Just to get help from anyone, tell me, is my voice is okay? Dr. Ramesh, if you can, please. Is my voice clear? Any colleague, please? Is my voice clear? Sorry. Can you not hear me, please? Hello?
Yes, sir,
Hello?
it's clear. It's very
Clear.
clear.
And then the screen is okay? The
Yes,
screen?
sir, you can see the
Thank
screen
you.
also.
Thank you very much. Thank you very much.
Yes, sir, we can hear you, sir.
Thank you very much. Okay. So today, welcoming you all again. Today, our topic is very technical topic, especially very important. Those who are appearing for the AKT exam in coming diet, as well as those who appeared but not well oriented with some technical informations, they will get benefit as well. So we are going to start now and be with me until the end. Is my humble introduction for all of you and from our institute again. The topic we selected for today is the AKT syllabus and exam preparation. Some tricks about for the exam. And most of you, almost all of you, definitely have some technical messages, informations. But today, hopefully, we will tell something might be new to you, I believe. And this information's definitely new for today also. We didn't discuss before also. It is true. So my humble request, be with us until the end of the session. And syllabus actually is very non-specific term rather to say. And we heard about the word syllabus throughout our study life in our previous classes, schools, college. So today our topic will be the topics or syllabus of AKT, utilization of the learning materials for exam, how to study SBA, as well as how to attempt mock or exam question. Finally, how to organize your AKT exam preparation. So you understand now that each and every point is very important for you now. Suppose if we start with a question of the exam here and how and why the AKT orientation is important, you will understand from here. Suppose I'm reading for all of you. If anybody wish to read with me, you can keep your hand raising in the Zoom, then we can invite you. So let me read it first for you. I am reading quickly and all of you please follow me. In this question, I will read as it is, but not in an exam or mock mood. So just simply reading like a text. A 45-year-old woman attends with foot pain. She reports she has had pain affecting the underside of her right foot for the last 3 to 4 weeks. She denies any injury or trauma. The pain is worse when she wakes in the morning and takes her first few steps, and after she has been rested for a prolonged period and then gets up to walk. The pain locates to the posterior third of the plantar aspect of the foot. On examination, you are able to reproduce the pain with firm palpation about 4 to 5 centimeter anterior to the heel. There are no other examination findings of note. Which of the following is the most appropriate image to perform at this stage? Please go on the options, and now anyone tell me what is your decision now. If anybody attended before, please you don't answer. Those who couldn't attend this scenario before, please, anyone from those of you today, what will you choose as answer? What imaging you will choose? Scan, resonance, MRI, even not imaging at all, X-ray or ultrasound? Can anyone try? Nobody? If you cannot try, actually discussion will not be much helpful. Somebody will think that, okay, I will do X-ray, and myself also in my practice, I do the plain X-ray of the heel. So I hope that some of you also advise the heel X-ray. Or anybody advise the MRI of the heel region or the foot? Anyone? Somebody ultrasound? But better to tell. Doctor, please. Please, who wants to say? I cannot hear the voice. Please, anyone. What you like to do? What image?
Ultrasound scan.
Ultrasound scan. Okay. And somebody will tell X-ray like me today. But interestingly, the answer is no imaging. You may now make a debate, or you can say answer is confusing. So now who will be in favor of no imaging? Can anyone? Can anybody say that best answer will be no imaging? Okay, but we cannot stay more here. The explanation is that suppose if you go through the patient scenario, almost you are confident this is calcaneal spar or plantar fasciitis. 99%, 98% you are sure. In that respect, for the diagnostic purpose, no further investigation needed. So this is the flavor of family medicine, or rather to say the AKT exam. So we need to learn AKT, the techniques and others of the exam. For that, we told in your notification in the group that every exam has its unique nature. So we need to know the uniqueness of these. Anyway, with this introduction, we are going to show you the topics of the syllabus of AKT. We will not discuss, you just look at, and you understand that these are all cardiovascular topics, cardiovascular systems, and these are very common topics in our day-to-day life practice. Next is the respirology. I will be actually running rather with the slide. If you need to have any explanation or something, you can just tell me in between, no problem. So these are the gastroenterology, including hepatobiliary disorders and the pancreatic disease as well. And this is the, you understand now, the acute chronic cognitive deficits and others. And this is from the geriatrics. So geriatrics is age-specific topics, and it include all the system relevance. Now the endocrinology, diabetes always number one, and the thyroid and other endocrine disorders. And this is the urinary tract disease, including nephrology and the urology both. And then the dermatology. And if you feel better, we can make a snapshot, or we can provide later also. So this is the musculoskeletal disease. Actually, musculoskeletal disease includes rheumatology and the orthopedics as well. So we are dealing family medicine, not the internal medicine or surgery. In this respect, musculoskeletal disease means both discipline, rheumatology and the orthopedics. And now the nervous system neurology, including some neurosurgery as well, though these are not too much important for the family physicians. Then the psychiatry or the mental diseases, including the child psychiatry and the substance abuse. So these are under psychiatry or mental disease, and these are the therapeutics or drug related. We tell the name of the topic here, even in our coming course also, pharmacotherapeutics. So these are the major headlines, no doubt, major headlines. And these are the infectious disease, special attention to the South Asian diseases or the tropical diseases, including sexually transmitted disease. And we will cover actually here of pregnancy related. So that means the infections during pregnancy, though it will be part of the women's health, but it is parallelly important under the headline of infectious disease like gum, genitourinary medicine. Another name is sexually transmitted diseases. These are the hematology, including the investigations and acute emergency in the general practice or family practice. So again, it is not a specific system, rather it is a broad term under which the emergency situations of all the systems are covered, including medicine and surgical aspect as well. For example, burns, bite, stings, wound management, so and so, including the head injuries, that is the neurosurgery as well. And these are ENT with the facial lesions, ENT, ear, nose, throat disease. And this is the ophthalmology, eye related problem. Again, ophthalmology maybe there might be some surgical issues as well, but mostly ophthalmology covers the medical aspect, the common primary eye diseases, and definitely eye disease in relation with the systemic disease, especially the nervous system is important. But in the family physician or family practice, the eye disease means primary eye disease are more important. These are, you understand, women's health, including obstetrics and gynecology. There are infectious disease, malignant disease, and others. And in the reproductive medicine, we can add also the male health as well. So women's health and the man's health both together here. So in the man's health, it will be more elaborated, not only testicular disease and others. There will be some other topics also during class or others you could see. And especially surgical issues, and the authors cover the breast problem under the surgery and other common surgical problems as well. These are some glimpses we are trying to show you as a part of the exam headlines. And you see that the pediatric areas is a very big chapters. Common diseases of pediatrics, common many systemics, especially the respirology, gastroenterology. And the right side you see is a big list: nutrition, malnutrition, many other issues, child abuse including. That means some social issues also important. So this is a big list here. And these are the, rather to say, biostatistics and the research methodology. That this is evidence-based medicines. Again, it is also important, and it is very emerging topics throughout the world. And after these traditional topics, very important topic is ECG in the AKT. Not only AKT, it is important for the OSCE as well. Then the X-rays, especially the chest X-ray number 1. Then other X-ray, including still contrast X-rays are not much available in the exam, but in future, I like to say that the simple contrast X-ray of various regions could be added in future. Primarily non-contrast are important. Similarly, CT scan and MRI, especially CT scans, are almost available throughout the world now. So very simple and easy CT scan could be added in your exam in future, though we are not including the CT scan in our running or coming exam batches. But we have already prepared before also some master classes of the MRI CT scan. Anytime needed, we can include in our course. And the third is now, especially in a special part, is the clinical picture in the clinical practice. And both were important not only for the AKT, it is important in the OSCE as well. And possibly some of you attended our clinical picture classes. And the fundoscopic picture. In the OSCE, it is not yet decided that doctor is to do the fundoscopy, but doctor is to understand the fundoscopic picture. So it is not only for AKT, it is for OSCE also important fundoscopic picture. Though definitely common and simple, don't worry. So up to these are the AKT syllabus headlines we tried to show you. I believe and I hope that all of you understood. For that nobody raised your hand. So then we can now switch to the next topic today. Even then, anyone is to ask anything about the syllabus, please. Somebody definitely thinking if you are appearing the exam or listening or hearing something from many angles, many sources. Any comments or queries from you, doctor, about the syllabus? This is the headlines already I uttered, but there are broad description also. It will take many minutes. Just try to give you some glimpse of the headlines. Okay, if it is useful, now we are going to start some other parts, some tricks and tips of AKT preparation. How to do that means a practical planning of the AKT exam. So again, requesting you be with me. First of all, the preparation materials are many in the table like these, so you might become puzzled which one you like to choose. So it depends upon your interest, your desire, your deficiency. Then you will decide which menu will be best suited for you. Otherwise, if you want to take or test from everything, it will be very impractical and dangerous for you. So suppose we are trying our best in the environmental group, rather to say, you may have some other connection, other attachment. So you need to decide with whom you will go with you for your exam preparation. And in the learning part, what materials? Many materials you can say, but in our understanding, we divide it in these ways. The textbooks, lecture video, notes, question bundles, exam recalls, mock exam, and many other related materials, including collection of the notes or books or many things. So actually what we will do or we were doing before is we group the learning materials in these headlines, and we found it is very effective and useful. So now how to decide and how will you utilize the materials? First of all, ask yourself how many times in your hand. So today, those who are here, if anyone appearing in the coming exam, now you understood you have around 4 months plus, rather to say. January, February, March, April, and the May you are appearing, suppose. So you are having 4 months plus. So in the round figure, you can say we have 4 months in our hand. So we need to utilize the time. And suppose if you want to read many textbooks, so it can cover 1 month together, 30 days or more than 30 days. So we will not read simply textbook. We will read in a technical way, stepwise. And that we will try to show you now. After having the mind that this duration in my mind, now the textbook reading, I told you many books are there and you know about the book name. But the Royal College advised to go through such things. Clinical evidence, British Medical Journal and other. But all the things are gathered in, suppose in the world there is many, rather to say the authors not like to say, they are our helping people. They are gathering the questions, advising many things, many years in many part of the exam, in many exams, not only for the family medicine, and popularly till now for the AKT rather, the past medicine informations are very basic, and we agreed to others also. We need to learn, and these collection of learning materials cover actually many things. These clinical evidence, journal issues, but they are not telling from this book. So if you want to read the book, this is the Oxford Handbook of General Practice. This book can cover around 80% or more than 80% information as a general practitioner or family physician. So don't be worried with many other books. There are many big books also in the world. Again, remember you have only 4 months plus some time in your hand. But if anyone decide to appear the exam not in the coming diet in the later on, you may think a little different. But even then, no need to read too much textbooks, because this is exam preparation, not to gather the widespread knowledge of the topics. Okay. Now, stepwise, what will be the first step? First step is prioritize the system. Or not system, if you want to start with the generic topic like X-ray, ECG and other, or the women's health. In that respect, we mean all the things in a system. So prioritize with which system you like to start with. That means definitely the system you are weaker, you need to start with this system first. And then start to know what is your need for the exam. You are not very medical student. You already having store of the knowledge. So what do you need to know? Now what you need to know, how can you understand? This is the question. For this reason, you need to attend the discussion topics, your groups or your mentor or facilitator. If the discussion around exam, then you will understand, okay, I need to know it. I don't know about this. Then you can make a list. You can focus your required issues. Okay. Then if you understood that, suppose for cardiology, usually we start with the cardiology in our classes or in the module as well. In the cardiology, after the discussion of the lecture, then you understand that you are weaker in these points. Then you make a note for further reading. Now, how to read the further informations? If you want to say, okay, you can go through the book. An Oxford Handbook is not very big one, rather to say, if you say about the cardiology, so there are a couple of pages are there. But what to start with first, the book or the question bundle? Our humble suggestion is start with the question bundles, not with the textbook. Again, remember 4 months in your hand. So if you go through the question bundles again, though you extend your knowledge, but still there are something else what you need to learn further. Okay. And how to organize the topics? Suppose this is the cardiology topics. I don't know how many of you arrange the topics like this manner. These are the question bundles collections, and definitely we will provide it in this way. We actually gathered like that in an alphabetic manner so that you can identify the topic. Suppose you will read hypertension. So you see from hypertension, from here in the second column, the last the file rather to say, from there up to here, that means a full column. So whenever you come to study the hypertension, you need to open each and every topic from here. So this is very core and technical message. Why we are telling? Because if you go through the hypertension details in the textbook, the book definitely will take more time, And all of the informations are not important for your exam. Remember it. But as the question bundles are there, remember that the informations given here almost 95% important for you. What about the 5% remaining? It is uncertain. You don't know. Informations could be there, but around 95% informations you could see here. So whenever you study hypertension, sorry, hypertension from here, not the bottom, I was wrong. From this one, the hypertension up to down, you need to read each and every one. Whatever you need management earlier or diagnosis earlier, no matter, like this. So suppose if it is a chronic heart failure in the cardiology, you see the heart failure, chronic heart failure is gathered here. Similarly, atrial fibrillation is here. So like this, you need to organize your material, and it is not an easy job, I understand, because from our side we have done it in a team of the people, not by any single one. And we have done it in the few months back, we have done it for you. So after this, you have finished, suppose like this. Again, you see we covered like this in this way. The hypertension questions are there. Similarly, these are from osteoporosis, especially in the geriatric medicine. If you want to go through the osteoporosis, you can read everything from there, including the drugs of osteoporosis diagnosis or follow-up. Many things you can get there. So in this way, you finish your learning bundles from the system, one after another. Now come to appear, how to appear SBA, single best answer. A wide and detailed discussion given in this YouTube link of ours. If you are interested, you can go through there. You can request message later on. We can provide the link to you so that easily you can reach there. Or if you have the YouTube link with you already, you can search there. But just for actually simple ideation, especially if anyone very new to us today, a 67-year-old male presents with dyspepsia, which started about 2 months ago. He thinks he has lost some weight. On examination, he looks a little pale and has some angular stomatitis. What is the most appropriate management strategy? Now, please, this is your turn now. You need to respond now. What do you like to do? Please quickly. Anyone, please. We'll be very grateful if you have anyone reply. Please, anyone. Don't feel shy. You are practicing, you are reading as well. So can anyone reply? I'm sorry for you. Nobody is replying. So these are the key words in this way that the management plan could be anyone from 5. Now can anyone try? Don't feel shy. You might be wrong. So what? Can anyone feel shy? So we need to identify the 67-year-old advanced aged has some features of nutritional deficiency and patient lost some weight also. So these are the red flags. In this respect, with upper GI symptom, there is the dyspepsia, answer will be urgent gastroscopy. You will refer. But in the internal medicine or specialty, answer will be endoscopy. But as a family physician, you are not doing endoscopy. So your answer mode will be referral for urgent gastroscopy or endoscopy, whatever you say. So this again a difference in the preparation of the AKT. Anyway, so these are just a message only. I'm just clicking. These are the red flags. Okay, this is not the main issue today. Just to tell you the informations. Now, read the relevant whole guidelines. Suppose the previous case we discussed importance of the advanced ages, importance of the red flags. You will get everything in the books as well as in your question bundles. Okay. After reading the question bundles, what we mentioned, still you have some lackings of informations, then you go to the guidelines or textbooks or the journals. If you have time, remember. So you have time means, suppose you are busy with the cardiology or respirology initially, a big list in front of you, don't think that you have time. We need to have a budget of days for the cardiology, budget of days for the respirology. From there, if you have time. So this is plus minus. After reading all the materials, then go to your mock exam. That means system mock. We design a system mock, for example, cardiology. So it is more likely that in the system mock, you may not be 100% correct. There may be some technical issues also. If possible, I will discuss later. From the mock, again, create some queries in a short note in a book. Then search the answer as you have gone through all the materials in your hands. So even then, you don't know the mock question answers. So again, try to get it from the reading some extra text. But the best thing is ask or discuss in a group with your friends. Or in addition, you may get some support from our AKT WhatsApp group. This is the group link. I hope all of you understood it. Already available in our group. So it is not too much thing we are doing, just we are continuing our support and guidance for you. So you may get some support from there. Now, before attempting complete mock, suppose you finished your system mock, and before attempting the complete mock, each mock having 200 questions. In between this time, that is system mock, you finish, then take few days and then appear the complete mock. In this time, before the complete mock, study the recall questions. Interestingly, we have a significant number of stores of the recall sessions, video records. If you don't have the video records, if you have only text notes like PDF and other, you can go through. But as interactive records, definitely more helpful than reading the text only. So you finish all the recalls, then appear complete mock. Our suggestion is during the mock, complete mock, spare your time. It is around 3 hours 30 minutes time in your final exam, but try to finish your exam before 3 hours 30 minutes. It would be best if you finish at 3 hours. Okay, the 30 minutes is plus minus. Then it will be useful for your timing and you can finish your 200 questions. In the net based exam, online exam, it is very easy. No need to cover the area by the pencil. It is very easy. So try to do it. And our exam also will be digital exam in the coming course. And 5 to 7 days before you attempt the mock exam, and I know some of the colleagues couldn't have enough time to prepare, but my humble suggestion, minimum 7 to 10 days or 2 weeks around, keep only selected for your exam preparation. Definitely, if 1 month, definitely better and the best, but minimum 7 to 10 days or 2 weeks, if you don't have time in your hand, your exam preparation will not be quite good enough. So minimum 7 days before you attempt the mock. Many mocks are better, but minimum 2 mocks if you attend, it will be sufficient. Okay, and from the mock also definitely you will see that you need to know a little more. Always I'm telling you need to know little more, because we believe that nothing is 100% in the world. So there are still remaining something to be learned more. And the day before exam date, don't be busy with a specific topic. Think in general so that other systems, other messages will actually, what I say, the moving around you. If you be busy with a specific topic or specific system, other system will be far away from you. For that, The day before exam day, better actually day of the relaxation. But how many of us can move here and there, going for outing or chatting something else other than exam? It is very impractical. But suggestion is get relaxed. Don't be very serious before the exam day. Already your brain having inbuilt all of the messages in the previous months. Don't be afraid. This is natural. Almighty created the brain in a manner. If you have gone through 2-3 days before something, it will be stored in your brain. If you could read with your emotion, with your attention. So in the previous day of the exam, don't be very busy with each and everything. It will increase your anxiety. So get relaxed on the day. So on the day of exam, how to appear. So I will tell you now some technical points. Suppose we divide the question in two groups. One is the text-based question. There will be no picture. So this is a question I will not read. If anybody interested, you can read. Just look at the 58-year-old lady comes to see you for repeat blood pressure reading. That means you measured before, you are confused, or your colleague measured before. Then you need to diagnose patient is hypertensive or not. Now what you will do? Our suggestion is in such question you identify the key messages or key informations from the learning or the questions. So in the exam hall, I am telling the exam question. Already I told you how to read SBA before, is a different link. I didn't show you details. This is another way. But in the exam time, you need to go through or identify the keywords here. And if it is a paper and pencil based exam, you can make a mark there in the question sheet. In the question sheet by giving a round like that. Just I'm moving the cursor like that, giving the pencil mark there. But those who will appear in the online, you may not get this chance. But you need to remember this thing. These are the keywords. If you consider these keywords, then it will be easier for you to decide. Definitely we will utilize the knowledge of hypertension from there in this algorithm. If you come across the algorithm, definitely you will choose the correct answer from there, that the best option is arrange ambulatory blood pressure monitoring. So this is the text-based question. Now come to the pictorials. Our suggestion for the pictorials, it will be a little different. I'm not asking your answer from here, but discussing the techniques. Suppose this is the question exam. In the paper, you can see the picture and the text. In our previous experiences, and some of you also have this experience maybe, in the question of the pictures or the pictorials, main focus is the picture. The messages given in the text is less important. They are actually testing our picture identification qualities. So in that respect, if you look at the picture first and look at the question only, it will be easier for you to reach a diagnosis. Now can you respond that by looking the picture only and these are the options, what could be the answer here possibly? Please, anyone, please help me and help everybody if you can respond. What your answer here?
Oncogryphosis.
Oncogryphosis. Okay, suppose oncogryphosis. Somebody will tell it could be fungal infection, that is the onychomycosis. Somebody will think it could be even the psoriasis also.
Peritoneal dystrophy.
Okay, but what will be the best answer now? Then you decide up from there. Then go to the text. Then decide from there. Identify the keywords. The patient has this nail problem along with itchy rash in the groin of 6 months. So patient having additional features of the same disease. Now it is clear to that this is psoriatic nail disease or onychomycosis. Why this is onychomycosis? Itchy lesions, doctor. Itchy. In the groin. Psoriasis happen in the extensor surface mainly. Understand? Doctor? Somebody responded. Can you talk to me again? So it is more likely onychomycosis, fungal infection of the nail. Okay. And usually, if you think again in the picture, psoriasis can happen for each and every nail because it is a very systemic disease. But fungal infection will not be that much widespread. Sometimes fungal infection of the nail can happen only in the single nail or in the single finger. But psoriasis usually more widespread. Though it will not be too much distinguishing. But the key word will be the itchy rash in the groin. Doctor, clear now? Sorry, I cannot read your Arabic name. Sorry to utter. So that this will be the answer. So the technique we described is look at the picture first. Okay. Now come to the picture questions, concept and design of the picture, pictorials. I'm showing you another picture and I will discuss in a different angle. Suppose this is a question, you all of you possibly know the answer. This patient presents with painful raised lesions plus the informations in the picture. Now try to understand. Before giving the treatment, we need to know the diagnosis. Okay, how to diagnose the case. Suppose this picture is not there. Suppose this picture is not there, you see. Then they would give you the question in a way, that is the stem of the question is, this patient presents with painful raised erythematous lump on anterior lower limb. Doctor, do you understand what I mean? That means there will be no picture. The message will be, if the question is text based, then this whole information will be there. So what I mean, or what you understand is, the things are not clear in the picture, it is written as a text. Suppose the lesion is painful or not, who will tell in the written exam? But the picture, the having the lesions red color, erythematous, it is obvious. So if the picture is given, this erythematous word will not be there, even lump also will not be there. Okay, lump may not be visible in the picture also sometime, but sometime it is visible. And the location is the anterior lower limb, picture is telling. So this is the philosophy of designing a question having the picture. So now, who will say the answer here? All of you understood now? Picture is described there also as well. That means we need to correctly describe the description of the picture. This is the description already. So what is the diagnosis? Please. Nobody trying.
Erythema nodosum.
Erythema nodosum, right. If erythema nodosum, it is not the treatment actually, which drug was she recently prescribed? That means there is a drug side effect. So which drug caused this? Again, is the matter of knowledge. Cotrimoxazole, there is a sulfur-based drug. Okay, so we are not discussing erythema nodosum here. We are discussing the techniques of questioning. I hope things are clear. Okay, so these are the brought to headings, text-based and the picture-based questions. Now, if you don't know the answer at all and you don't understand the answer also, but you must attempt questions. That means attempt the options of the answers. So how you can do, we already discussed before how to give the blind answer. This is the link in the YouTube, you can see there. So we advise all of you to know about this just before the exam, not from the beginning now. But assure you that you will get it in the YouTube how to give the answer without knowing the answer. There are some technical things we discussed and hopefully sometime it is right. Sometime it is right. Now, in the bottom line, what we like to advise you, organize your learning materials. What we said, it is in pro forma has shown to you. So you need to organize your learning materials. And interestingly, it's not easy for you. Some of you can do it easily, but some of you need some help. And the concepts of the family medicine exam question, from these question also a little further, why you need to organize and you need to think a little differently like family physician. Again, I like to highlight here, suppose this patient is having the back pain, sharp stabbing pain, worse on the movement, and positive straight SLR is positive, the positive straight leg raising test is positive. Appropriate analgesia given, patient is not improving. So question is, what will be the most suitable next step in the management? And I like to say you are suspecting this is prolapsed lumbar intervertebral disc. You are thinking, confidently you are thinking, there is no doubt. So what you will do now in your next step? Please, can again respond anyone? 1 minute please, to make the discussion better.
Refer for MRI.
You will do refer for MRI. And other colleague also would be doing the same, refer for MRI. And we have seen also in our practice, not practice, in our training period rather, our teachers are doing, neurologists are doing, or internists are doing MRI. Can anybody have different of opinion? Difference, not MRI, something else?
Physiotherapy first before MRI.
Doctor, you are giving double answer. Someone, you have given one answer MRI. If you jump to another answer, no problem, physiotherapy. But someone is to say, please open the mic. Someone wanted to say maybe MRI. Yes, Dr. Suja, what you are thinking?
Physiotherapy.
Physiotherapy. Why not MRI?
Because the woman is around 38 years old,
Yes.
and it seems to be a sciatica kind of a pain.
Okay.
So
There is a compression
before,
of the nerve.
yeah,
Then,
and we have given adequate analgesics as well.
okay.
And the thing, as we GP, first we don't go for a hi-fi stuff. So first of all, we'll go like
You are not thinking as a hi-fi doctor, high
yeah, no,
profile doctor. Oh,
yeah. Straight away, you don't need to refer the patient for the MRI, right? Before
that
that,
means
we
that
have
is
never.
sorry to discuss. I am also feeling myself as family physician doctor. I am now associate professor in a department of medicine in my college, and
Mhm.
hopefully, inshallah, going to be professor very soon. So, do you think that I am very what I say? Actually, thinking is not in a way what you are thinking correctly underlying. Thing is that what is the evidence base is telling. What we are looking, what we are learning, what we are seeing in our day-to-day learning is not the correct one, is not the evidence-based one. Okay, Dr. Suja?
Mhm.
We need to do some decision, go for the decision which will be the best evidence-based. This is the thing.
Okay. Mm.
Suppose we have seen and we are seeing also any or spinal surgeon, neurosurgeon, or even the internist, straightforward, we will go for the MRI. I will advise, you will advise MRI.
Mm.
But the family medicine, what we are going through, actually, they are thinking very, very minutely, very meticulously, and trying to organize, gather the evidence base. And by the evidence base, the best option is here is physiotherapy. Okay, not for
Mm.
MRI. If you if you go for the MRI, not harm that expenditure. Okay, expenditure.
Yes. Mm.
And if further MRI needed, when if any surgical intervention is needed, then MRI is needed. We have to identify the exact location of the compression and other. But it is found that after the analgesia medication, if you go for the appropriate physiotherapy session, it can be controlled. Because If MRI proving this compression also, the initial management course will not be changed. We have to send for the physiotherapy first after the medication. So the MRI will not be the best option here as answer. So this is the glamour of family medicine, just to tell you. But MRI will be useful after 4 to 6 weeks. Patient is still having the trouble, then go for the MRI and for the subsequent management. Okay. Thanking you for your joining. Now the another patient, doctor. It is a very clean-cut scenario of the carpal tunnel syndrome, where positive TNLs and the phalanx also positive. So you understand clinically you are much confident if you go through by yourself, by silent reading also. It is a carpal tunnel syndrome. Now what will you do? Please, now you can share by your voice. There are 5 options. What will be the best option? This will be your AKT answer. Please, anyone? Nobody try? Yeah, doctor, please.
Wrist is split.
Explain. Will you not refer the patient to specialist doctor? Or will you not advise for the nerve conduction study? To be sure that to confirm the carpal tunnel syndrome, the compression of the median nerve there. Doctor, please discuss. You don't bother. You don't care about the further evaluation. You are giving straightforward for the
confirm.
management. You need to confirm first. If you need to confirm first, your answer will be what? Nerve conduction study. Okay? Isn't that it, doctor? Please, someone is to join again in the discussion. Nerve conduction study you can do. Okay? But yes. But again, like the previous
What about answer E?
rest, eyes, elevation, review in 2 weeks. No, rest,
It's
eyes,
very,
elevation, doctor, will not be too much helpful for the carpal tunnel syndrome.
yeah.
Thing will be nocturnal wrist splint. Answer
Yes.
will be best here. There are some clues also there. Okay, again, nerve conduction study will be important to pinpoint the compression. But as a patient presented with the typical features of carpal tunnel syndrome, we need to solve the pain. We need to start the treatment. Again, in the question, it is called the lead in Dr. Sujoy or someone.
Suja.
Suja, please.
Yeah.
Please have a look. What is your initial management plan? Did you see the word?
Yeah, initial plan.
Initial. So initial is not the whole thing, whole management. In course of time, we may go for the nerve conduction study. Then we will refer for the hand surgeon or someone else later on. But initial or primary management be given by the family physician. Okay? And it is
Yes.
not the family physician also. I can remember, or you can also understand that an internist, medicine specialist seeing a patient. Okay, there is a compression of the spinal cord by the malignant deposit. Definitely MRI needed and neurosurgery's opinion is important. But the internist is to do higher doses of steroid to minimize the compression on the spinal cord. That is the initial management. So initial management, if any hospitalized patient also, some specialty doctor is to apply before sending to the specific department. So as a family physician in the chamber, we need to go with it. And there is the difference of exam result. If you give the answer here, refer for surgeon or for the nerve conduction test, you are or we are thinking I am right in my answer because throughout my life I have given it, I have advised it, and my senior teachers are doing this. But the tricks is in the different angles. That is the angles we are trying to discover for you. So I hope you understood the technique, the concept of this. So treatment should be initiated because the diagnosis is very clean cut. So primary or initial treatment should be initiated by the family physician. Okay. So these are the main issue, doctor, and these are our contact informations. If anyone want to be connected with us again, this is the WhatsApp. Possibly all of you know, and this is our number, WhatsApp number. You can communicate with us for anything. Now your question, doctor, if you have. We just finished our technical primary informations from our side. If you need to know or any question, you can ask now, doctor. Please, anyone?
If you don't mind, shall I ask some
Please,
basic questions?
please.
How many questions will be there in the exam?
200.
200. The pass marks will be 50%. Oh.
It is not fixed usually.
Uh-huh.
There is a very, I cannot explain that thing. This digitally they are calculating the marks. Sometimes it is called the scaled digital method. They score the highest score counted as 100%. Minimum is 0% or like that. There is a computerized. So
Okay.
overall, we like to say in general in our calculation, non-digital method or understanding, minimum your answer 60% should be correct there. Minimum. Okay.
Okay.
60%. 60.
So all the questions will be a single best answer questions, right?
Single best answer. Single best
Okay.
answer. Okay.
Okay. Thank you.
No more? No more, doctor? I think all of you understood. And timing, it is not MRCGP UK exam. UK exam having a less time, but in the South Asian exam having 3 hour 30 minutes time in the single session. Thank you very much. Thank you. All the best. Okay.